Introduction. Many seniors may feel well most of the time, but sometimes subtle changes in the body may mean serious health risks. Doctors urge seniors to stay alert to 5 silent signs that could suggest the end is near. Recognizing these signs early can lead to medical help or comfort measures. It can also allow time to say goodbyes and get needed support. This simple script explains each sign, why it matters, and what seniors and their families should do. Sign 1. Sudden loss of appetite and refusal to eat. As people age, hunger may lessen, but a sudden drop in appetite or refusal to eat or drink can be serious. The body may close down because it is no longer using energy the same way. There is less interest in favorite foods. Meals may be skipped without complaints. Weight loss may accelerate. This sign may last days or weeks. Loved ones should offer gentle encouragement to eat and drink, but not force it. Doctors explain that if chewing or swallowing becomes hard, pushing food may do more harm than good. In these cases, comfort feeding like small sips of water or ice chips may help. Some families worry tubes are needed, but doctors often say tube feeding may cause more discomfort in near-end stages. Instead, allowing the body's natural process while offering comfort is usually preferred. Sign 2. Extreme fatigue and withdrawal. A senior near death often sleeps much more. They may not have energy to talk or move. They may sit quietly or lie down for long periods. They may not respond to visitors or conversation. This is different from normal tiredness. It is deep, wide fatigue. Tiredness may come even after little activity. Seniors may close their eyes as if drifting in and out. They may seem distant. Doctors call this a sign the body is conserving energy for essential functions only. Families should respect the need for rest and speak softly. Trying to force activity or conversation may upset or tire the person more. Instead, staying near quietly and offering touch or gentle presence can bring comfort. Sign 3. Changes in breathing patterns. As death nears, breathing may shift. One common pattern is called Cheyne-Stokes breathing. It is a rhythm of fast breaths followed by slow breaths, and sometimes long pauses. Breaths may become shallow or labored. The senior may breathe through the mouth, making gurgling or rattling sounds. This happens because the body is not clearing fluids from the airways. The breathing may become irregular, sometimes fast, sometimes slow. These shifts can feel worrying to families, but often are not painful. Doctors advise families to keep speaking calmly, not covering the mouth, and perhaps gently turning the person's head or giving a moist sponge to the lips. Oxygen is not always helpful at this stage. Instead, comfort measures matter more. Sign 4. Confusion, vision changes, or restlessness. Some seniors become confused in their last days. They may not recognize family members. They may see things that are not there or believe strange things. This is called delirium. It can come and go. Seniors may try to get up when they cannot. They may pull at sheets or look frightened. Vision may blur, or they may stare at nothing. These signs may cause families to worry about mental clarity. Doctors reassure that this is often part of the process. It does not always mean suffering. To help, families can lower noise, keep lights soft, offer familiar objects like a photo or cloth. Kind touch and calm presence can soothe. Medication is sometimes used if distress is severe. But many seniors benefit from peace and reassurance rather than sedation. Sign 5. Changes in skin, circulation, and body temperature. When the heart pumps less well, extremities like feet, hands, and legs may feel cool to the touch. Skin may look pale, grayish, bluish, or mottled in color, especially around knees, hands, or arms. There may be swelling from fluid in one part of the body. Body temperature may drop, and seniors may feel cold even under blankets. This is a sign of reduced blood flow and slowing circulation. Doctors say it means the body is focusing on vital organs. Families can keep blankets light and warm, avoid overheating, and massage warm lotion gently. It helps to keep hands and feet covered. These changes do not typically hurt, but may look startling. Knowing what they mean helps families stay calm. Why these signs matter. These signs together indicate that the body is winding down. They appear over hours, days, or sometimes a few weeks. Not every senior shows all signs. Some show only one or two. But when several appear, doctors take notice. It means the end may be near. Recognizing them helps. Comfort care teams may shift goals to improve peace rather than cure disease. Family members can prepare emotionally and practically. Medical crises, such as trying to revive or force feeding, may be avoided. Seniors can receive spiritual, emotional, or palliative support if desired. Doctors warn but offer reassurance. It can be hard to hear, but seniors and families are not alone. Doctors urge families to ask about hospice or palliative care if these signs show up. Hospice teams focus on comfort, pain control, and emotional support. They guide families about what to expect. This support may include visiting nurses, social workers, counselors, chaplains, volunteers. Their job is to help patients and families through this time gently. Messages from doctors to seniors and families. Listen to the body. Subtle but steady drops in eating, energy, breathing, clarity. Skin tone are signs to take note of. Stay calm. Keep the environment peaceful. Speak softly and with reassurance. Don't force meals or activity. Offer presence. Hold a hand. Run warm hands or lotion over skin. Play soft music. Adjust light. Invite quiet visits rather than large crowds. What to do when you see these signs. If you notice one or more signs, contact a medical provider to confirm prognosis and clarify goals of care. Ask about comfort care at home or in hospice. Discuss advance directives, wishes, and legal documents. Invite family members or friends if desired. Take time to talk, forgive, say goodbye. Practice self-care as caretaker. Accept help from professionals. Real-life examples in simple language. Mrs. Roy had trouble eating. At first, she just passed on dessert. Later, she stopped meals altogether. She slept most of the day. Her breathing became shallow and rattle-free at night. She saw people in her room who weren't there. Her hands turned bluish sometimes. After doctors explained these signs, her family kept meals simple and small, spoke softly, and invited the hospice nurse. Mrs. Roy passed peacefully 2 days later, surrounded by quiet and loved ones. Mr. Singh grew weaker. He stopped responding to visitors and just closed his eyes. He breathed slowly with pauses, and his skin looked pale. Doctors told the family these signs meant death may be near. They held his hand, played his favorite old hymns, and covered him in a soft shawl. He died the next morning peacefully in his sleep. Important myths clarified. Some think not eating means suffering. But in final stages, eating may cause nausea or choking. Small sips and mouth care kinder. Some believe breathing troubles mean pain or suffocation. Usually it is not painful, It is the body slowing down. Families worry if loved ones don't talk or respond. Often they still hear voices and feel touch even if they do not respond. Visitors think they must say something, but presence and quiet love matter most. Simple tips for families. Create a peaceful space. Lower lights. Reduce noise. Soft music. Offer comfort items. A favorite blanket or pillow. Photos. Speak in short, calm sentences. Give gentle reminders of who you are. Touch with love. Hold hands. Massage warm lotion lightly. Keep mouth clean. Offer small sips or ice chips. Wet lips. Avoid force feeding. Use hospice support. Ask nurses or counselors for guidance. Plan for emotional needs. Talk to faith leaders or counselors. Summing up, the 5 silent signs are loss of appetite, extreme fatigue, breathing changes, confusion, and skin or circulation shifts. Individually, they may mean health is poor. Together, they often mean death is near. Doctors urge seniors and families to watch gently, seek support, and focus on comfort. There is no shame in accepting that the body is winding down. Instead, there is peace in being prepared and staying present. What families often ask about end-of-life signs. When people notice the 5 silent signs doctors warn about, they often have more questions. Some worry they're doing something wrong. Others are unsure what to expect next. It's normal to feel unsure or afraid. In this section, we'll explore common questions and provide clear answers based on what doctors, nurses, and hospice workers say. Is my loved one in pain? How can I tell? Many people worry that their parent, spouse, or loved one might be in pain, but unable to speak. Doctors say there are ways to watch for pain without words. A furrowed brow, clenched hands, stiff body, or moaning can be signs. If your loved one shows these, they may be uncomfortable. Hospice and palliative doctors use special tools to check pain levels even in people who cannot talk. They may give medicine to ease discomfort. These medicines are given in drops, small pills, patches, or even creams. They don't try to cure the illness. They help the person feel peaceful. If your loved one seems calm, with relaxed hands and face, they may not be in pain. Their breathing may be slow or uneven, but this does not mean they are suffering. The body is simply slowing down. Ask your nurse or doctor for help if you're unsure. You are not alone. Can they still hear me? Should I keep talking? Doctors and hospice workers believe that hearing is one of the last senses to fade. Even if a person does not respond, they may still hear and feel comfort from your voice. Families are encouraged to keep talking. Speak softly, clearly, and lovingly. Say things you want to be heard. You can read poems, share memories, or simply say, "I'm here with you." Tell them they're loved. This may bring peace to both the person and their family. Sometimes people wait until certain loved ones arrive before they pass. Other times, they seem to pass quietly when left alone for a moment. This is all part of each person's unique journey. Why do some people seem to perk up just before passing? This is called a rally. In the last day or two, some people may suddenly seem alert. They may talk, smile, or ask for food or visitors. This can give families hope, but it is often brief. Doctors say this short burst of energy may happen as the body prepares for its final hours. It may be the last chance for connection. Use this time to say anything left unsaid. Listen to what the person wants. Sometimes, people choose this moment to say goodbye. Although it can be emotional, It's important to know that this does not mean recovery. It is part of the natural process. What should we do if they stop drinking or eating completely? In the final days, the body no longer needs food or water the same way. Trying to push food or water may cause choking, stomach pain, or discomfort. Doctors say it's okay to let them stop. Instead, offer mouth care with a sponge or soft cloth to keep lips and mouth moist. You can apply lip balm or swab with cold water. Small ice chips may help if they can still swallow. This care keeps your loved one comfortable. They're not starving. Their body is slowly shutting down in a natural way. How long can this stage last? It varies. Some people live days or weeks with these signs. Others may pass within hours. There is no fixed timeline. The body follows its own path. Doctors often look at patterns. If all 5 signs appear together, note eating, deep fatigue, breathing changes, confusion, and skin changes, death may come within days, but not always. Families are encouraged to focus on comfort. Stay near. Use this time for peace, not panic. Let the person feel safe, not rushed. Should we keep giving medicine? Some daily medicines may no longer be needed. Pills for long-term health, like blood pressure or cholesterol, may be stopped. Instead, doctors focus on comfort medicine only. This includes pain relief, ease of breathing, calmness, or reducing nausea. These can be given in easy ways, by mouth, skin patch, or even drops under the tongue. Ask your care team to review the medicine list. They will guide you on what to continue, stop, or change. You can always ask questions. You have the right to understand every step. Should we call emergency services? This depends on the goal. If the goal is comfort, then calling emergency services may not be needed when these signs appear. If your loved one is already receiving hospice care, the hospice team should be called. They are trained to handle these signs with compassion. If you are unsure and your loved one is not in hospice, you can call their doctor or nurse. They can tell you what to do next. Calling 911 may lead to hospital trips, machines, or life support. For many seniors near the end, this is not helpful or peaceful. Talk with the care team about what your loved one would want. How can we prepare emotionally? Emotionally, this time is very heavy. You may feel sad, worried, guilty, tired, or confused. All of this is normal. Everyone grieves in their own way. Some find peace in prayer or faith. Others write letters or play calming music. Talking to friends, counselors, or spiritual leaders can help. Don't be afraid to cry. Don't be afraid to laugh either. Sharing stories, holding hands, or simply sitting in silence. All these are acts of love. Families often say they fear death. But when it comes, they realize it can be quiet, gentle, and full of love. Preparing emotionally does not mean feeling nothing. It means allowing space for all the feelings that come. What happens in the final moments? In the final moments, breathing becomes very slow. There may be long pauses. The person may not open their eyes. Their mouth may stay slightly open. Hands and feet may feel cool. You may see one last deep breath, and then none. The chest may no longer rise. There may be silence. It may take a moment for the family to realize they are gone. There is no right way to react. Some cry. Some sit in stillness. Some pray or speak goodbye. Whatever you do, it is okay. At this point, families may call the nurse hospice team or doctor to confirm the death and help with the next steps. There is no rush. You can take your time. Sit with your loved one. Talk. Touch. Take a breath. You've just witnessed one of life's most sacred moments. After death, what happens next? After death, the care team will guide you. They will help with calling the funeral home or arranging body transport. Some families choose to wash and dress their loved one at home. Others let the care team do so. Some families choose to wash and dress their loved one at home. Others let the care team do so. Grief may come in waves. Some feel numb. Others feel heavy with sorrow. Let yourself feel what comes. Reach out to friends, support groups, or grief counselors. It's okay to miss them deeply. It's okay to feel relief too. Relief that they are no longer suffering. These emotions can exist together. Closing words. Death is one of life's hardest truths, but also one of its most natural. For seniors nearing the end, the body often gives quiet signs. Doctors encourage families to watch with care, not fear. Loss of appetite, deep tiredness, changes in breathing, confusion, and skin changes may all be part of the body's way of letting go. These signs are not warnings to panic. They are reminders to be present, to sit close, to speak softly, to hold a hand, to say, "I love you." In these final days or hours, what matters most is not doing more, but being there with love and calm. If your loved one is showing these signs, know that you are not alone. There are nurses, doctors, and helpers trained to walk this journey with you. There is no right or wrong way to say goodbye. What matters is kindness, comfort, and peace. May these words guide you in a time when words are hard to find. May you feel strength in your quiet care. And may your loved one pass in peace, surrounded by love, not fear. Thank you for listening, for learning, and for caring.